CICO occurs when we cannot intubate the trachea and cannot maintain oxygenation through mask or supraglottic devices. Though rare, about 1 in 10,000 anesthetics, it can rapidly lead to hypoxia, brain injury, and death if not managed swiftly. First principle, call for help early. Second principle, prepare for emergency surgical airway immediately. The causes vary: airway edema, trauma, anatomical anomalies, severe laryngospasm, failed ventilation with muscle tone loss, but the response must be prompt and decisive. Recognizing CICO during airway management, continuously assess oxygenation and ventilation. If intubation fails, immediately attempt a supraglottic device like LMA. If the LMA fails or ventilation by face mask fails despite adjuncts and maneuvers, declare CICO out loud. Use the vortex approach to guide decisions. Imagine a funnel. The outer ring is effective oxygenation by any non-surgical means. If you fall into the center, failure of face mask, supraglottic airway, and ETT despite best efforts, it's time for CICO rescue. No more than 3 attempts per device, and change something after each attempt: position, adjunct, size, or technique. Remember, time matters. A dropping SpO2 or prolonged attempts signal impending catastrophe. Act without delay. Responding to CICO, move immediately to emergency surgical airway (ESA). Options include surgical cricothyrotomy, the gold standard, rapid and reliable; needle cricothyrotomy as a temporary bridge if surgical airway is delayed. Surgical cricothyrotomy steps: identify the cricothyroid membrane, make a vertical skin incision, make a horizontal stab incision through the membrane, insert a tracheal tube or bougie into the trachea, ventilate. Needle cricothyrotomy steps: insert a large bore needle, 14G, into the cricothyroid membrane. Confirm air aspiration. Connect to a high-pressure oxygen source. Provide oxygen via jet ventilation. However, remember, needle cricothyrotomy is a temporary measure. It cannot sustain ventilation long-term and risks barotrauma. Ultrasound can assist in identifying neck anatomy pre-induction or during emergencies. Practice drills regularly because in a real event, seconds count. Important, SpO2 alone is not the deciding factor for CICO rescue. Key points: don't delay after failed best attempts at face mask, LMA, and intubation. Declare CICO loudly to mobilize the team and focus efforts. Prior preparation saves lives. Ensure surgical airway kits are immediately available. Even with an SpO2 that seems adequate, oxygen reserves may be critically low. Decisions must be based on the airway situation and timing, not just saturations. Once CICO is declared, attempts at non-surgical oxygenation must stop. Commit fully to surgical airway access. In summary, recognize early, call for help, minimize wasted attempts, proceed rapidly to surgical airway. Stay calm, act fast. In CICO, hesitation kills, preparedness saves lives.